everybody, welcome back to the Teach Back Method, where I teach you guys something I'm learning about in grad school to help me understand it better. For today's video, we're going to be talking about types of feedback in neuromuscular education. Let's break it down. The first type of feedback I would like to talk about today is called intrinsic feedback. Now, if you were to Google this word, it actually means belonging naturally. Now, in the physical therapy world, intrinsic feedback is something that is inherent through the patient's own movement. Now, what this means is this type of feedback is internal. So this is what happens when the patient's own movements send signals to themselves and they don't need that external feedback. Now, how I like to remember it is from the eyes. Intrinsic, internally. The second type of feedback I would like to discuss today is extrinsic feedback. If you were to Google this word, it means coming from the outside. Now, in the physical therapy world, extrinsic feedback is supplemental information. Now, this type of information is very commonly coming from the physical therapists themselves, and it can be demonstrated with visual cues, verbal cues, or tactile. Something else I would like to point out is extrinsic is also known as augmented feedback. For the remainder of this video, we're just going to talk about extrinsic feedback, also known as augmented feedback. And we're going to dive into the different types of feedback that fall under this category. The first type of extrinsic feedback we're going to discuss is qualitative feedback. Now, when you think of qualitative, think of quality. And this type of feedback is from the therapist to the patient, and it helps the patient to focus attention on a specific body movement. So this really helps with refining that coordination. Now we're going to discuss quantitative feedback. When you think of quantitative, think of quantity. And this is used by the therapist to the patient regarding the movement as a whole. And this can be very motivational to a patient. Next, we're going to discuss the next two kinds, knowledge of results and knowledge of performance. I personally get these backwards a lot, so let's dive deeper into it. So, knowledge of results. When you read the word results, think of outcome. And this is about the movement as a whole. Hey, this is how you performed, this is what your results are, and this is what they mean. Versus knowledge of performance is more focused. So we're talking about the quality of the movement. Hey, when you're performing this task, we really need to focus on this particular motion. So in contrast, we have an internal focus and an external focus. So this is more of a big picture, and this is about the movement individually. The next topics are a continuation of the previous types of feedback. So we're going to discuss internal focus and external focus. So remember, internal focus is used with knowledge of performance, and external focus is used with knowledge of results. So if you know these two or know these two, we can kind of differentiate the differences and how they connect. So with that internal focus, we're directing the attention on a specific body movement. So remember, this is what we're doing with knowledge of performance. It's a very specific body movement rather than the whole picture. So if we're talking about an external focus, this is really goal-directed, all about the big picture. So remember, this ties into our knowledge of results, which is the outcome of the patient's performance. I hope this helped you to really learn about the different types of feedback, especially extrinsic type of feedback. If you want to learn more, come back to my page. Thanks.